I've been doing programs for a long time, and you'll notice this morning is a little bit different because of the historic nature of the 25th anniversary. I wanted the members and the attendees here to become introduced to some of the key people over the last decades who have really championed this issue to bring us to where we are now. And you've met some of the founders of this academy this morning. You're going to meet some more this afternoon, and some of the key people. This academy, now 25 years into it, some of the people who will be speaking today were ones that we selected specifically to kind of give you a perspective of what's gone on. But as Mike Paulk pointed out, there's a history of this issue that predates this academy. Some of the originators of this academy, the founding members, were really introduced to this issue by Dr. Hal Huggins out of Colorado. And one of the few people that Hal actually will give credit to in predecessing or preceding him is Dr. Olympio Faissol Pinto out of Brazil. While Hal was the one that turned a lot of us onto this issue, and maybe a less scientific bent than this academy has done, Olympio was the one who really taught Hal about this issue. And Olympio's involvement in the mercury issue goes back over 50 years. He's still in active practice in Brazil. And it was actually Olympio's father, who is also a dentist, who actually got him involved. And I want to give a little introduction. Olympio could not be here in person this weekend, but we've got a little presentation on DVD or some other thing, some other technological advancement here. So we're going to let you see this first.
My problem started in 1958 when I came to the University of Georgetown to work on a master's degree. In my early bibliographical studies, after having found over 100 publications, there was one that completely solidified my conviction that mercury was deadly. And that was the work of Dr. Carl Frickholm in the Acta Odontologica Scandinavia, Volume 15, Supplementum 22. With the use of radioactive mercury to tag the dental fillings, Dr. Frickholm was able to follow the track of mercury as it underwent electrolysis and mercury vapor formation throughout the entire organism of the patients, not only of the patients, but of the dentist himself and the nurse that was attending at the chair side. Dr. Frickholm found through the use of radioactive mercury that mercury has an affinity for the cerebral cortex, for the heart muscle, for the kidneys, for the liver, and for the bone marrow. And in this way, Dr. Frickholm sealed my conviction that mercury is a deadly material and it's unfit to be used as a restorative material.
Bear with us here. This was sent up from Brazil, and the technology is a little different there, but there's another addendum to this.
In 1965, after returning from the United States, I started a full-time practice in oral rehabilitation. For every patient, I removed all mercury detoxicated by massive vitamin and oral chelation or intravenous infusion in the most serious cases. In the first years, I measured mercury in hair, urine, and saliva with an atomic absorption spectrophotometer. For every patient, the greater the number of mercury fillings, the highest the mercury in hair, urine, and saliva, and the worse the case. In 1992, to coincide with the United Nations Conference for Development and the Environment, Rio 92, I decided to organize the Eco Odonto to allow dentistry an introspective view of our professional ethics and responsibilities.
Rio Echo Odonto captured the interests of the media, and the event caused serious repercussions. New information and accusations came to the surface.
It was during the Echo Odonto meeting that we brought Hal Huggins to Rio, and we brought Murray Vimy and David Kennedy and Yamo Yanis, and we had a fantastic meeting. And it was during this meeting that this letter arrived to my hands. And I would like to read a fragment of this letter because it tells the story of Dr. Hans-Peter Liss. Dr. Hans-Peter Liss was a 57-year-old chemist and biochemist of the Polytechnic University of Zurich in Switzerland. I mind you, not of a third world country, but of first world country, a professor of chemistry and biochemistry who suffered mercury intoxication for years. And for many years, he studied neurology and toxicology himself and had many rounds of discussions with the professors of medicine in the University of Zurich. I would like to read the fragment of the letter of Mrs. Hans-Peter Liss. She wrote me a letter that was shocking and moving. She said, when I came for him in the hospital of the city, he told me, they finally convinced me that I am really crazy. In the following days, he began to become more and more distant about his thesis of mercury intoxication. In the January 11, he was feeling very well and he was very happy, and he went to his doctor and he wanted to bicycle. And he wanted to do something for his fitness finally. He requested that it was his birthday and he wanted a barbecued lamb. He never returned home. At night, the police came bringing his farewell letter. He's committed suicide. Ever since, my life came to a standstill. To give you a close, I would like to show you the case of Dr. Teresa, a physician specialized in clinical analysis, who diagnosed her own acute lymphatic leukemia. Dr. Teresa came up to the office. She had mercury in her hair, she had mercury in her urine, she had mercury in her blood, and she had mercury in her mouth. Her gingiva was bleeding profusely. She had a platelet count of 22 when it should have been 250,000 at least. And she bled to death days after she showed up in the office for a diagnosis. I asked her what were the symptoms that she had, and she said she had tiredness, hematomas, petechias, bleeding gums, and she began passing blood in her stools. I also asked how long ago she had started placing mercury fillings in her mouth. She said that she had started ever since she was 15 years old, and she was now 33. So it's 18 years ago. Along all these years, I asked, did she remember of being depressed, shaky or trembling, lacking concentration or gastric disturbances? So she said yes, gastric disturbances, stomach aches, tiredness.
At the end of the interview, Dr. Celso and Dr. Teresa made a dramatic appeal to the international scientific community.
The clock is ticking against us all. We need more scientists with the courage to challenge. We need more investment in education for prevention and more knowledge in biocompatibility of materials. so that no more families have to face the trauma and the agony of such improbable flight. With immediate hospitalization, blood and platelet transfusions, and further chemotherapy, she might have a chance of avoiding generalized hemorrhages from an extremely low platelet count. Being a pharmacist and a biochemist and married to a physician, Dr. Teresa made her option. There were good doctors, but the hospitals were poor. They were equipment poor, they were personnel poor, they were scientific poor. They were only risk rich. She refused any further chemotherapy, and I met her in late September when she was bleeding profusely from the gingiva and everywhere else. The chronology of Dr. Teresa's leukemia started with a mouthful of mercury fillings. What worries us is that in Rio de Janeiro alone we have 11,000 dentists spilling mercury over the sewer lines. What will happen to our children when they get mercury in the mother's milk? I think thousands of years from now, the archaeologists will find a mercury-free human DNA in the layers of our ashes, just after a 200-year-old mercury contamination.
So you have just, I wanted you to see Dr. Olympio Pinto. This is the son of the gentleman who actually first discovered problems with the amalgam and sent Olympio, the son, also a dentist, to Georgetown, my alma mater, to get a master's degree, because in Brazil there really were no medical, in the small town where Olympio Sr. practiced, there were no medical libraries to find out what was going on, because the father was taking out amalgams from his patients not because of health reasons. He wanted to have, he didn't believe amalgams lasted that long, and he wanted to just use gold, which was pretty cheap back in those days, especially in Brazil where they mined it. And, but as he was taking amalgams out, he noticed anecdotally that patient after patient were coming out of certain health issues. So we've arranged, because Olympio could not be with us today, his father died just actually a few years ago in his mid-90s. We've arranged to get him on the telephone so that you could say hello to him, and he can give us a little bit of a story that I wanted him to share with you. So can we get that keyed up? You know, this academy has done remarkable things, and Olympio is probably one of our biggest cheerleaders. But if we see it further, it's been said, if we see further, it's because we stand on the shoulders of giants like Murray Vimy, Jess Clifford, Hal Huggins, Murray, as I said, and of course Olympio Pinto and his father. So when you track back the history of this issue, it really goes back to this gentleman and his father in this decade, or in this century. Do we have Olympio? Olympio, can you hear me?
Yes.
Oh, okay, good. We've had a little technological challenge getting to you, but thanks for your persistence today with us.
Yeah, I'm glad to help.
Well, as you know, I'm here in Las Vegas at the IAOMT 25th anniversary, and I'm in a room of about 250 people, and they'd like to say hello to you first of all. So, hello, Olympio.
Hello. Hello, everybody.
And
God bless America.
Thank you. We appreciate the fact that you weren't able to be with us in person today, but we are so happy that you're here in spirit with us. And I appreciate your having some time today to just say hello to the group and to maybe just give us a little bit of the history about how you and your dad got involved with this so many decades ago.
That's right. Well, first, I want to thank the Academy for deleting our profession from the quackery list, because you guys did a long time work, and eventually science is like the truth, not even the whole darkness of the universe can hide one candlelight. I would like to send special gratitude for Michael Ziff and Sam Ziff, Chess Clifford, David Kennedy, Murray Vimy, Boyd Haley, Sandra Denton, Lydia Bronte, Sam Quinn, Matt Hansen, Patrick Starterbecker, Carl Frickholm. I could be hours reciting all the names that helped. And I am very proud of the International Academy of Oral Medicine and Toxicology.
Thank you. Did you want to share with us a story that we had talked about?
Oh, yes. The story was first told to me by my dad with eyes full of tears in my graduation day. He related to me that in the mid-30s he had already helped hundreds of people in the Midwest of Brazil, and it elicited some jealous from physicians that couldn't help people, and even practical dentists who were using silver amalgam as their bread and butter everyday work. It's low cost, easy to do, easy to teach, and it reaches the largest part of the dental practice. So they were furious at my dad, explaining that it had to be taken out and replaced by gold inlays, because gold is not does not participate of any chemical reactions in the mouth. It was quite interesting, and it was a moving story when my dad told me that one Sunday he woke up with a noisy horse at the door of his office, and when he went out, there was a horse with 6 or 10 strings of empty cans tingling, and they scribbled with ink at the door, "Quack, leave town." And then when I graduated in 1957, he told me that it had been quite a few decades of criticism and humiliation, and they said that he only wanted to work for people that were rich and famous, and that silver amalgam was necessary to reach the large public of people who could not afford. And my dad used to say that precisely because it's cheap, easy to do, easy to teach, and long-lasting, that it will make a cumulative intoxication in the largest part of the population. But it took now 50 years for people to realize that, It's precisely the public we must protect from long-lasting health consequences that we need to take the cheap fillings out from. When I came to Georgetown for my master's degree, my dad again told me the quack story, and I dove in the books and in the bibliography, and the more I studied, the more I found that heavy metal poisoning was kind of universal, and it was quite an exciting confirmation for me in 1958-59. And then the dean looked at my proposal and sent me to speak with Dr. John Houck, who was a PhD in enzymology, and he told the dean that that was the best project he had read in the last 10 years at the university. However, unfortunately, the radiochemistry lab, which was necessary to tag the mercury fillings, was busy for the next 2 years, and I could not have scholarship support to stay that long. So I had to drop the subject, and the dean, who was Admiral Rolt, he advised me to find another topic because otherwise I would never graduate. So it has been a long story of criticism and ridicule and bad mouthing by most of my colleagues, which is only last year, I think, that the FDA finally recognized that mercury can be harmful. So I am therefore very proud that you guys at the International Academy of Oral Medicine did a fantastic job and had a lot of perseverance to keep the work going until the truth surfaced, you know. We just have seen the tip of the iceberg because the extension of the damage is quite astronomical. And today you see that Prozac, for example, is one of the highest selling drugs for depression, and I don't think Prozac can cure mercury intoxication, which is one of the main reasons for depression. So I think you people are to be congratulated for your fantastic work.
Well, Olympio, thank you for those kind words. I would tell you, as I said a little bit earlier, is that if this academy has done anything extraordinary, it is because we have been standing on the shoulders of giants, and you, my friend, are one of the giants. And I want you to know that we have an award here which I wish I could give you in person, but it is the International Academy of Oral Medicine and Toxicology Humanitarian Award made up to Olympio Faissol Pinto, and it says, for your selfless dedication and courageous leadership in promoting the truth and safeguarding the health of the American people, dated today, September 11th, 2009. And of course, this goes out to you as well as to your father and your mother, both dentists who helped lead us all on this path. So I want to thank you, and on behalf of the whole Live Academy, please take our warmest welcome and congratulations to you.
Thank you very much, Richard. I am really touched by your remembering my name, and I can assure you that it was worth all the fighting, the sacrifice, and the humiliation, and the humbleness of holding up for 50 years, you know. And I know you guys have an elite of professionals, otherwise you wouldn't have been able to do what you have done so far.
Well, thank you. We got to see their video we shared with the Academy a little bit earlier today, and you're still looking great after 50 years of fighting the fight. So our thanks to you.
Thank you very much, Rich. I sent you a couple of emails just in case we had difficulty with the connection.
Well, thanks so much, Olympio. And I just got word a little bit ago that one of our scientific advisory board members, Dr. Louis Chang, is going to be in Brazil in December, and he's going to be looking you up.
Oh, please have him look me up. I'll be very glad to have him as my guest.
Yeah, he's standing right here nodding his head. He'll be looking you up. Okay.
Okay.
Olympio, thank you for everything you are and have done.
Thank you very much, Rich. I really appreciate, and I'm proud of being part of the group.
Thank you, and we're proud of you.
Okay,
thank you.